and good afternoon. It is time for our regular Friday Lunch and Learn. And today's going to be just a little bit different because we put out a post a couple of weeks ago. What do you want to learn about? What questions do you have? How can I help you? And so I have a list. I'm going to start with some of the easy things and then progress to some of the harder things. Totally unscripted, so I'm not going to be reading a report or talking about a report. So if you want to join in the conversation, I'm going to try and see the comments as they come up. Sometimes I don't see the comments until way after the live broadcast, so don't know how that's going to work, but we're going to try. When we ask these questions, we need you to be as specific as possible. So we're going in the order that I received them, and we're going to start with menopause. So obviously somebody, I would imagine it would be a female, who wanted to know about menopause, but she didn't say what she wanted to know about. So I'm going to kind of go into a discussion of menopause and different things, and if you have a question about that, pop it in the box, and if I can get to it, I will. So overall, menopause is the age at which a female person stops producing eggs. She'll quit having her period because there are no more eggs, and the body says there's no eggs, there's no reason to have a pregnancy, and so we're just going to quit with the monthly getting the uterus ready for implantation of an embryo. We're not going to do that anymore, so we're just going to cease. All right, that happens around age 50. Now, a lot of people think that you have to have a hard menopause. It's all kind of miserable and that kind of thing. For me, it was not, and it doesn't have to be for you either. So a lot of times people think that hot flashes and irritability and all of that go with menopause. Well, not necessarily. At the same time as we women are going through menopause at around the age 50, it can be 48, it can be up to 55, but usually it's in that age range. That is also the time when we need to start detoxifying our liver. Now, why is that? Because the liver is the largest filter in our body, and it becomes congested. Why does it become congested? Because we're not moving our bowels 2 to 3 times a day, because we live in a stinky part of town where we have all kinds of airborne contaminants, whatever. And so at the same time as we're going through menopause, we're also getting to that, I don't know exactly how to say that, but we get to the point where our liver just can't handle anymore. It's very congested, and so it starts wreaking havoc with our emotions and that kind of thing. What we have found in clinical practice is when we start working on the liver, detoxifying the liver, all of the hot flashes and irritability go away. So they're not going to tell you this at the doctor's office because they just are not going to, they have not made that connection. But in our world, holistically, we deal with the whole body. So you may have stopped your monthly cycles, but if you're not working on detoxifying your liver at the same time, you may have some of these uncomfortable hot flashes and that kind of thing. So when you go through menopause, you stop making estrogen, you stop making progesterone, or certainly as much as you used to. Now, I will tell you from a medical OBGYN perspective, not mine because I'm not medical, I'm just researching, right? But from a medical perspective, your OBGYN should tell you that most cardiovascular events for women happen when they are postmenopausal. Why is that? Because estrogen, bioidentical estrogen my body makes, is a cardioprotective hormone. That means it protects my heart. When I go into menopause, I make less estrogen, and so my heart suffers because I don't have estrogen. So my OBGYN friends say that you need to protect your heart by making sure that you're getting enough estrogen in your system. Now, there's all kinds of complications with that if you've had breast cancer and all that kind of stuff. So this is not the place where I can discuss that. However, this girl, all right, as far as I know, my heart is right. I've had it checked out. Everything's good. However, I've been postmenopausal probably about 15 years, right? I take a liquid adaptogenic herbal formula every day. Why? because it gives me estrogen when I need it. It gives me progesterone when I need it. It's adaptogenic. That means it looks at my body, what am I needing, and it gives me what I need for day to day. So that's one thing that you can do if you are menopausal and you're worried about your heart. If you're menopausal and you're irritable and you have hot flashes, then I would suggest that you need to go and have a liver detox protocol so that you can get rid of all the toxic things in your liver, and then you're going to be much better on that end. If you are having problems with intercourse, if you're having problems with vaginal atrophy, that's a whole nother ball game. Some people have that, some people don't. When you are older and you stop making your hormones and you're not doing bioadaptive, bioidentical hormones, then the vaginal tissue can become atrophied, right? So just like you don't use your legs and your muscles kind of shrivel up, same thing with the vaginal tissue, not necessarily because you're not using it. Most women find when they do have vaginal atrophy that they are not enjoying intercourse, that it's painful, that they feel a little bit fragile down there. And that's because of lack of estrogen, lack of progesterone. So we do have topicals that you can do vaginally, or you can just do on your inner thigh or on the pubic area or whatever. The creams go right into the site. They repair vaginal atrophy. So if you have that, then we've got help for you on that end. There's no reason why women should suffer just because they get to be a certain age and they don't have their hormones and their cycles moving the way they do. So that's kind of a broad-based overview of what menopause is, okay? Menopause is not the end of your sex life. It doesn't have to be. However, you may need a little bit of support for that. We have a medical person that we do refer to if you need more help than I can give you. I would just tell you, stress sucks up all of your hormones. I remember a few years back, I just wasn't feeling myself, and I went and had blood work done, and I had 0 hormones. How can you have 0 hormones? And I have all my stuff, I have all my parts. And so I was talking to my colleague, and I said, okay, I've got all my parts, I take all this stuff. How do I have 0 hormones? She said, have you been under a lot of stress? Well, as a matter of fact, at that point in my life, I was under a great deal of stress. I had family members that had been diagnosed with cancer. I had all kinds of different things that I was dealing with. And so my colleague said that when you're under that kind of stress, your body, the stress just sucks up all the hormones that you have. And so on my blood work, 0 detectable hormones, right? So that's not good. I know that's not good. It's not good for my heart. So I had to go get some medical intervention on that with bioidentical hormones. Did that for a short period. I was able to replenish my storehouse, and then I'm able just to keep going day to day with the things that I have here. So you don't have to suffer in silence. Please don't. Reach out. I know this is an intimate topic, but reach out if there's anything that we can do for you. And there is certainly life after menopause in all of its ramifications. So, reach out if you need help on that. The second thing that's on my list is sciatica. Well, what is sciatica? Well, on your spine, you've got your SI joint, right? So your sciatica is usually right or left, and it's right at the back where your hip joins your leg, okay? So what can happen with this nerve, it's a nerve, it can get pinched in the joint. It can also be twisted. Lots of different things can happen to that. So one of the things that I do, I used to suffer from this a long time ago, and my massage therapist gave me this exercise to do. It's really, really easy. You can do it at home. I'm not going to show you because I would have to get on the floor. You don't want me to get on the floor, right? So but I'm going to tell you how to do it. I'm going to use my arm. So pretend like this is your leg, right? This is your leg. Pretend like my sciatica is on this side of the body, right? So I'm going to take this leg, I'm going to bring my knee up to my shoulder, and then I'm going to butterfly my knee out away from my body. What that's going to do, it's going to elongate your spine, and it's going to let that nerve drop from wherever it is encased, okay? So you bring that leg up, and then you butterfly it out. And when you do that, that nerve is going to come down, it's going to be unimpinged, and you're going to be a happy girl. All right. Alternatively, I would send you to Dr. Brackney. Now, Dr. Brackney is a myofascial expert. What does that mean? That means he works with muscles. He's also a chiropractor. All right. You know, if you've had any kind of chiropractor experience, you go to the chiropractor and they'll say, well, you need to have X amount of treatments for X amount of weeks, and then we'll have a break, and then you come back for X amount of treatments and X amount of weeks, right? What they're doing is they're realigning your body, but they're not working on the muscles, and it's the muscles that hold you in alignment, right? Dr. Brackney, he gets you in alignment, and then he works on the muscles to balance out the muscles, because you've got tension, right? You've got a muscle that pulls and a muscle that relaxes. When they are in balance, you stay in balance. So sometimes we have a muscle that's pulling way too hard, or one that's relaxing way too much. And when that happens, it pulls us out of alignment. When they work on the muscles stay in alignment, and then you are a happier person that can work for any kind of discs that are not right. It can work for sciatic pain. It can work for just all kinds of things. So we really like chiropractic. This is me, I do not like the chiropractors that crack you. I don't think that that's healthy. I don't think that's the way our bodies are supposed to be. I think that when they do decompression, when they pull and stretch so things can get realigned, I like that. So just whatever you're happy with, you go ahead and do, because you're the queen or king of your own body. I don't particularly like that. I remember being at a conference a few years back, and there were a lot of chiropractors that went to this conference, and they were invited to bring their tables and to work on each other while we're having our breaks and that kind of thing. Well, I was standing about 6 feet away from a chiropractor and he had somebody on his table. And I wasn't really paying attention, but I happened to cast my eye, saw what he was doing, and about that time, he took that lady's neck, and it went, and you could hear it. I could feel it 6 feet away. I could feel it, and it just went all through me, and it was like, oh, not going to see that guy, because that was just too much trauma on that body. So you may have a different opinion. That's my opinion, and that's how we're going to go with sciatica. All right. Scar tissue. People are asking about scar tissue. So scar tissue is when you have had a puncture or a cut or an accident or however, but your skin has been opened in some way. Your skin is made up of collagen. When you've not been punctured, your collagen lays down very, very flat, like a basket weave, okay, or like a piece of fabric. You've got your warp and your woof and all that kind of stuff. It's very, very flat. When you have a trauma, a piercing, a stabbing, an accident, a cutting, whatever it is, then the body rushes collagen to that area to close up the gap. Why is that? Because your skin is your number one immune defense. Nothing gets past the skin, right? And that's why when you have a cut, depending on how deep it is, you can maybe, if it's just a little bitty thing, put some, Neosporin, some silver cream, some whatever on there, put a Band-Aid on it, and it'll heal up in a couple of hours. If you have a huge cut, like you've been in surgery or you've been in an accident or whatever, it takes longer. You've got to go get medical intervention, and they may try and sew you together. They do that so that the collagen can start to form, and what it does is it gets in a very chaotic manner, and that's what makes your scar. You can't get blood supply or oxygen supply to a scar. Some people make really thick and ropey scars. Some people don't scar badly at all. It just depends on your DNA and the way your skin is. However, a few years ago, last year, almost a year, in February, I learned how to do scar tissue release, and that is a technique that if you have scars like abdominal scars from C-sections or chest scars from heart surgery or any kind of hip replacement or whatever, it doesn't really matter what it is, but if that scar is bothering you, if it's twisted, if it's ropey, if it's painful, then there are some things that we can do to get that worked out. Me, I had scoliosis when I was a little girl, and when I was 12, I had a spinal instrumentation. So they cut me from here all the way down almost to my tailbone, right? And then they, on this side of my body, they took about, well, I've got a scar about like that is very rippled, okay, and very, very tender to the touch. So I have these huge, big scars because of a medical intervention that I needed to have when I was 12. Now, fast forward all these years, I'm in my 60s now, and I learned about scar tissue release. And so I go and have this therapy done, and I will tell you, a scar that was very sensitive is no longer sensitive. It's not ripply anymore. It's very, very faint. There's hardly any color left to it because we've gone through and opened up that collagen, got it to settle down. We've got blood supply, nerve supply, oxygen supply going through that. So it is amazing what we can do with a scar tissue release. My stance even got better. There was a before picture and an after picture, and it is absolutely phenomenal of how that changed. If I think about it, I'll try and put that up there if you're interested in that, because scar tissue release is amazing. Now, the question is specifically about scar tissue with mosquito bites. Now, I lived on the lake when I was a little girl, got impetigo all the time, which means I had a lot of mosquito bites, and I scratched, and they got infected, and all that kind of stuff. I don't have any scars from my mosquito bites. I would never be able to tell you that I had a scar there. So if you have a scar from a mosquito bite, then you really tore it up when you scratched it, and you've got a lot of collagen that's mishmashed in there. That would be something that we could work on with scar tissue release. Or there are herbal formulas that will go in and soften up that scar and help that scar to go away. So I don't know if the scar is tender. I don't know if it's rough. I don't know anything about it other than what can you do for scars from mosquito bites. Scars, mosquito bites. I don't know if it's like scars is one thing. I've told you about that. All right. Mosquito bites is another thing. If you have enough B12 in your system, the mosquitoes don't like you. Who knew that, right? So if you are a magnet for mosquito bites, then I would say that you needed to up your B12. If you have the MTHFR, say that fast 3 times, MTHFR gene defect, SNP, okay, something you're born with, a lot of people have that. If you have that, you do not metabolize your B12, so you need to take methylated B12 so that your body knows what to do with it. And if you have enough B12, then that's going to alleviate the mosquitoes because they won't like you. They don't like the way you smell when you have enough B12. I mean, you and I can't smell it, but the insects can smell it. Alternatively, there are essential oils that you can use on your person that will repel mosquitoes. One of them is citronella. Okay, one of them also is lemongrass. Now, do I want you to coat your body in that? No, I do not. What I want you to do is get a little water bottle. This has water in it. It also, you can see it's all kind of cloudy, all right? And it's got particulates in it. I have essential oils on here. What do I have in here? I have antiviral stuff because I have a lot of people really close to me that come in and they're sick and all that kind of stuff, and I don't want to have that. And so I have antiviral essential oils in here, and you would do this with your citronella or your lemongrass or whatever. And I spray it. I just spray it on my hands, and I can smell it. We don't have smell-o-vision, so you can't smell it. But what it does, it gives me enough of the diluted essential oil. It's very strong. I can smell it. And what it does is it protects me and puts up a force field against viruses. Now, for you with the mosquitoes, you would do that, and you would put the citronella or the lemongrass or whatever essential oil that you like that has a repellent effect. Those two I know do. You put that on your body, and it puts up a force field, so when the mosquitoes come or the gnats or whatever, they don't like that smell, and they'll just go away. When it is diffused in this water, you're getting a very minute amount, and it's not going to hurt you. If you're just putting that essential oil on your skin, that's not good for you because some of these oils are very, very volatile and they will hurt you. So be very, very careful when you're using essential oils. Some of them you can't use and go outside, because if you go outside, you're going to have some problems, and you don't want to do that. But doing it the way I'm telling you is very safe. Put up a force field. You may have to reapply depending on how long you're outside and that kind of thing, but that should help you so you won't get the mosquito bites, or if you do get the mosquito bites, if you use the B12, you won't. So, afternoon fatigue. All right, a lot of people get this. What is this? Well, it depends on how old you are. Again, if you're over 50 and you're not decongesting your liver, it could be liver fatigue. Okay, so what you want to do, and there's all kinds of different herbs, and you've got milk thistle, you've got dandelion, you've got, there's just a plethora of things that we have here at the clinic that will go in and help you detoxify the liver. Now, a lot of times people will think, oh, I need to go have a detox program. Maybe, maybe not. Remember, we always test you to see what your energetic resonances are. Why is that? Because it takes a whole lot of energy to detoxify the body. And if you're falling asleep in the afternoon, you may not have enough energy to detox the body. We've got to get you built up on a really, really good vitamin, and then we can begin to detox. Remember, we've got this lovely little scanner, right? If you're in practice and you're a holistic person and you don't have this scanner, you are missing out. The supplements that this scanner brand makes are clinically proven to work, and a lot of them come with what they call the scanner score guarantee. What does that mean? That means if you take that product the way the manufacturers tell you to take that product, and in 90 days your score has not improved, they will give you all your money back. There is no company that I know other than this company that guarantees that their products work. So that's a big thing for me, because supplements that work cost a lot of money, and people are like, oh, that's a lot of money. But if you tell them this is guaranteed to work, and if not, the company will pay you back. Not me at all. The company will pay you back. So that's a really good thing, a really, really important thing. So if you have liver fatigue, your liver may not be making your vitamins, because your liver can actually make your vitamins from your food if you eat really good food. If your liver's not doing that, then you have that fatigue, you've got that irritability and that kind of thing. So I would say make sure that your nutritional uptake is good. Make sure that your liver has enough energy to detoxify itself, or you work on it, work with a practitioner to see to it that you are able to detoxify, and then make sure that you are doing what you need to do so that the channels of elimination are open. If you're not moving your bowels 2 to 3 times a day, every day, the liver has nowhere to go, okay? You breathe in, you have metabolic processes in your body, you've got lymph nodes under your pits, in your neck, in the groin area, and behind your knees. In there, you've got macrophages, phagocytes, all right, that eat up all the debris in the body. So that'd be metabolic debris, it'll be viruses, it'll be bacteria, it'll be parasites, it'll be whatever it is, right? So if we're not moving the bowel like we need to, well, let me go back. The lymph goes through the liver, right? And the liver cleans that, and it goes and it does what it needs to do. The blood goes through the liver. The liver filters the blood and cleans that. So all of that toxic matter needs to go somewhere. The liver metabolizes it in a way that either goes through the fecal matter or it goes through the urine. If you're not moving your bowels, it's not going anywhere, and so that's why your liver gets congested. How do you know your liver is congested? Well, that's a good question. I'm so glad you asked that. If you are a man and you've got that beer belly, your liver is toxic. If you are a girl and you've got the muffin top, then your liver is toxic, okay? And so we need to work with you on that. You get that resolved, your energy is going to come back, you're not going to have afternoon fatigue, and it's just going to be so much better for you, all right? The last thing I'm going to deal with, because I'm almost out of time, I still have stuff on my paper, so this is good. But the last thing I'm going to deal with is something called And I can't say the word because YouTube will ban me. But throughout the past 2 years, we've all been exposed to a certain particular virus, right? And there is long fatigue. It's called long hauler syndrome. So I'm going to talk a little bit of code, otherwise they'll ban the video. If you have that, if you contracted that virus and you have symptoms in your body that just will not go away for months and months and months, that's called long hauler syndrome or there's a word there, fatigue. Okay, how do you rectify that? Well, that's a very good question. A lot of things that you can do. One of them is you can do stem cell therapy. Now, they've got something, I think it's called angiosomes. That may not be exactly the right word, but it is an infusion that you can get into the blood system, and it goes and kind of regenerates in that way. You can do it nasally and regenerate that way. You can do something called a Myers cocktail, all right, which is an IV. You can go wherever you are in the world. You can type in on your search engine IV, Myers cocktail, and they will pop up. Let us come to you and give you an IV, right? And so these are paramedics that they do this. They come, it's all sterile. We've done it here, not for that, but for other things, dehydration and different things. And so they will come and they will put an IV in your arm that has all kinds of vitamins and minerals and all that kind of stuff. And it will really, really help if you've got that long, hanging on there. Now, viral loads in general, everybody is born with viral loads. If your immune system is working the way it needs to, your phagocytes, your macrophages are doing what they need to do, then when the body encounters them, the body chews them up, eats them up, they go through the liver, they go out of the body, and you are good. However, 95% of adults in the North American continent have Epstein-Barr virus in their bodies. Epstein-Barr virus, not many people know that you can be diagnosed with Epstein-Barr, and usually when you do, you're on a critical list, and you better get some intervention or you're going to be in trouble. But also, there are other viruses. I think mono is one that is a relative of the Epstein-Barr. Mono is something that a lot of people have, and it will continue to weaken you and plague you until you break that vibrational energetic signature. I was saying too many words at one time. We help you do that through homeopathy and different tools that we have here. We can do that for this specific virus that people are having in the last 2 years as well. One of the things that you can do is you can get medical grade hydrogen peroxide. Now, if you are on a weakened state, if your vibrational energy is very, very low, this could make you sick. So be careful here, okay? So we start out with 1 drop of hydrogen peroxide per 8-ounce glass of water. So what does that do? In your home, in your bathroom, you probably have something like 0.5% hydrogen peroxide. You can get it at 3%. You can also, medical grade is 35%. If you get 35%, it is a lot of oxygen in your cells, and if you are over toxic, we'll say that for lack of a better word, if you have issues, it can make you very, very sick. Now, you're not going to die. It's not going to make you like that, but you'll have diarrhea and you'll throw up, right? So go slow. Start with 1 drop per 8-ounce glass of water. Drink that. See how you feel. If you tolerate that well, then you can go up to your optimum dosage of 1 drop per 8 ounces of water. Still very, very dilute, but start slow and move up. What that does is it puts more oxygen into the bloodstream. When you have more oxygen into the bloodstream, then viruses do not do well with oxygen. That's why they tell you, go outside, get fresh air, get sunshine. Why is that? Because viruses don't do well in sunshine and fresh air with a lot of oxygen in there. So that's something that you can do if you've got viral fatigue in the recent past. So that's all the time that we have for today. I didn't see any questions. I know we've got people watching, If you have questions, go ahead and pop them in the box and I'll get back to them. I love helping you and working with things that you're concerned about. And so if anything didn't make sense, I apologize. None of this is, medical, like go and do this. This is information for you to research on your own, right? It's all holistic, all that kind of stuff. Why? Because we're holistic, we're not medical. So if you have any questions, let me know. It is the weekend. What do I always say? Do self-care. The week has been rough. There's a lot of things not done. There's a lot of things maybe you could redo, but don't worry about that right now. Rest, recover. Monday's coming up and you can fight again another day. All right. So thank you for joining me. Like, share, comment, all those kind of good things, because that tells Facebook that this was important and it gave you some value. And that's always my job, is to educate you so that you can make the very best choices for your own life. So I'm going to say goodbye and I'll see you next week and we will continue. Thank you so much.